Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting on our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with a 99% pass rate in our comprehensive review courses, as well as a 100% pass rate in our one on one sessions. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that I have on here are designed based on the guidelines that are currently being tested on the ANCC and AAMP exam. In any of my videos that I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one, you guys. Question number one states the nurse practitioner and NP student are discussing the ethical term for being fair. What is the correct ethical term that they are discussing? Is it A, accountability, B, justice, C, dignity, or D, beneficence? Tell me what you got in the comments. All right, so I always say read the stem of the question first. Read that stem so it allows you to slow down and that you can ensure that you're answering what is even being asked in this question. So here, the stem of the question states, what is the correct ethical term that they're discussing? They're talking about being fair. So is it A, accountability? No. B, justice? Yes. Justice, fairness. If you see this on boards, non-clinical is heavy on the ANCC exam. Make sure you know um, your non-clinical content. Study that material because there will be questions. Uh, it's over 60% of the exam, so make sure you know these terms. And I say all this stuff is knowledge based. You have to know the definitions, what is correlated with it. Be sure that you are on top of all of those areas. Question number two. Ms. Hall presents with her 2-year-old daughter. As the nurse practitioner completes that assessment, it is noted that the patient has a tongue with a strawberry appearance. What is the best diagnostic exam that the nurse practitioner should consider? Is it A, a CAT scan, B, a chest x ray, C, an echo, or D, nothing at this time? All right, you guys. So, stem of the question here is what is the best diagnostic exam that the nurse practitioner should consider? So, let's run it back. Anytime, you know how I go. If they are asking you to diagnose something, if they're asking you to treat, you got to run it back. You got to take it back and see what we even are dealing with and what you have going on. So this is asking for the best diagnostic exam. So typically we're looking at what the gold standard is to confirm the diagnosis that we are thinking based on how the patient presented, right? So here, this is a 2-year-old little girl. Mother brings them in, states that they noticed the daughter's tongue. It has a strawberry appearance. And when we're thinking about our pediatrics and thinking about our kids, key identifier as a strawberry tongue, it goes with Kawasaki disease. So a gold standard and a diagnostic exam and things that you want to do with someone with Kawasaki is to obtain an echo to make sure there's no vascularitis. This is the reason that we give the aspirin and the IVIG in patients with Kawasaki. You want to assess that heart. And I always say, think of it like this. When I think about Kawasaki, I think about a motorcycle. You're riding a Kawasaki motorcycle, your heart is racing. We need to check your heart. So strawberry tongue, key identifier, make sure you assess their heart. Do an echo, okay? All right, and question number three for today. The patient presents with unilateral facial paralysis. The nurse practitioner has diagnosed the patient with Bell's palsy. How should the nurse practitioner treat? Is it A, prednisone and acyclovir, B, aspirin and acyclovir, C, prednisone and aspirin, or D, prednisone only? Take a moment and tell me what you got, you guys. All right, you guys. So, stem of the question states, how should the nurse practitioner treat? All right, so we're talking treatment. We're running it back to see what the diagnosis is. If there's no diagnosis already given, we need to see what the assessment findings lead us to so that we'll know what diagnosis we are even treating, right? So here they already have told us the patient came in with unilateral facial paralysis, key and common in Bell's palsy. The patient has been diagnosed with Bell's palsy. So how do we treat Bell's palsy? A is your best answer. We treat with prednisone and acyclovir. Do not get hung up. A lot of people and a lot of review students in our one-on-one sessions are stuck on just prednisone. We do not treat with prednisone only. We also treat acyclovir because you want to also treat the cause. You want to treat the source. The prednisone is going to help with a lot of those symptomatic management, but acyclovir is also attacking that root cause. Okay, so A, prednisone, and acyclovir. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure y'all do what? Meet me back here, right? All right, so if you need any of our resources, if you are looking for review books to help study on the go, we have an ebook option and a paperback option. Both are linked in the bio of this channel. And also, if you are looking for review courses, we have a self-paced course that you can do on your own. It has everything broken down system by system, including the non-clinical section, and with many quizzes associated with it that you can listen to over and over. There's no limitation on that. Um, and if you need that, just let us know. And then our 5-week course, that link is open. You better grab it while you have a chance. It is filling up. I like to keep limited seats on this because I do work with you on that final week for an individualized plan to ensure that you are prepared and giving you advice to see engage your readiness during that time after completion and working to give you a strategy on what to do after we have finished this course if there's anything that you need to do outside of that. So I don't like to have too many people because I really like to work hands on with you on that last week. So that's the 5-week intensive review. So you see that enrollment is open for our upcoming June 10th class. And then our one-on-one sessions, you can shoot us a call or an email to see what works best for you because it is designed based off of what your needs are. So if you have a weakness that you just want to review, sessions are done for that. Or if you need the custom plan, which is, hey, I've been unsuccessful previously on boards, I need something to help me structure my studies and get back on track. That is what the custom package is for. Based off of your timeline that you would like to test, we gauge your weaknesses with a pretest. We work with you through this, structuring your studies and work alongside with you for that period of time to get you ready and taking you from unsuccessful to successful. So if you need any of those resources, just give us a call at 803 400 6864 or shoot us an email at thenursingstudio, the number one, at gmail.com. But make sure y'all meet me back here. Happy studying. Bye, y'all.